What if you're joining Medicare over the age of 65, or you're turning 65 but you want to wait to join Medicare? How do you do it? How do you not screw it up? Let's dive in. What if you're joining Medicare over the age of 65? What if you're turning 65 but you want to wait to join Medicare, but you don't want to screw it up? How do you do that correctly? Well, let's take a look at the different situations here and what you might be facing. So, those people turning 65 that don't want to take Medicare can really only do so in a legitimate way if they have credible employer insurance. Again, let me repeat that and break it down in more detail. Those people that are turning 65 but don't want to take Medicare can only do so if they have credible employer coverage, whether it's through their own employer or their spouse's employer, and it must be current employment. It can't be retiree insurance or COBRA and things like that. We'll touch on that in just a moment. But for those who are turning 65 and don't want to take Medicare because they have good work insurance, you can absolutely do that. You can wait to take Medicare if your work insurance is better coverage than Medicare, as long as it's employer insurance for yourself or employer insurance for your spouse. Those are really the only things that are going to let you wait to take Medicare without facing what they call the Part B late enrollment penalty. A lot of people call us at 65 and say, I want to keep working, but I don't want to get this Part B late enrollment penalty, so I think I have to take Medicare. Well, that's the biggest confusion. If you have credible work insurance, you don't need to take Medicare at 65, and you won't be penalized as long as you have insurance through your own or your spouse's current employment. So to avoid penalty, as long as you have credible employer insurance, you won't be penalized whatsoever as long as you hold that insurance consistently and there's no break in it between the time you turn 65 and the time you decide to join Medicare. If you've had employer insurance through an employer, your spouse's employer, and now you're over the age of 65, well, if you've gathered enough from the beginning of this video, that means you won't face a penalty and you can join Medicare late. But how do you do it? Well, there are a few ways that you can go about that. To join Medicare after the age of 65, if you have Part A already, the process is pretty simple. There are two basic forms that the government provides. There's a request to enroll in Medicare, they call it CMS 40B, and that's just a basic form that you'll fill out saying, I have Part A and now I want Part B. And there's another form that has to be completed with that called the CMS L564, and that's the request for employer information. This is a form that your employer would fill out, just attesting that you've had insurance since the age of 65. Those two forms together are what the Social Security Department is looking for to allow you to enroll in Part B over the age of 65. So again, if you want to start Medicare over the age of 65 and you already have Part A, two basic forms you have to fill out, the request to have Part B and the request for employer information, you submit those both to Social Security, whether that be by fax, by mail, or in person. The most surefire way to do it is to do it in person. Make sure they get the forms, make a copy of them. Sometimes things get lost in translation, and you'll want to make sure you have proof that those forms were delivered, and to do it in person is sometimes a surefire way to make sure that if they have time, they'll sit down and do the enrollment right there with you. Now that's if you already have Part A. If you don't have Part A, you have to sign up for that first before you can enroll in Part B. That can be done in a number of ways. One, you can call into Social Security. Say you'd like to enroll in Part A and they'll set you a date to do it. You can go to your local Social Security office and sign up for Part A. Or what's easiest for most people is you can go online to the Social Security website and you can then sign up for Part A online. While you're doing that online application for Part A, you can also say yes to taking Part B in that application, but that doesn't stop the requirement from you having to get those employer forms filled out and submitted to Social Security, because they won't give you Part B without a penalty unless you prove that you've had employer insurance since you turned 65. So for those people who want to join Medicare after 65, you can do that if you have employer insurance to hold you over in the interim. If you're joining Medicare after the age of 65 and you have Part A, well, all you need to do is fill out the two forms for Medicare, submit those, and they'll give you Part B. If you don't have Part A, you'll need to sign up for that first and then submit the forms for Medicare Part B. Time frame wise, you can fill out these forms or join Medicare Part B over the age of 65 really anytime while you're still working. If your work benefits get worse and you decide you want Medicare, or you're prepping up for a retirement, you can join Medicare while you're still working. Or you've got 8 months after the date that the employment ends that you can take Medicare with no penalty. And as I mentioned earlier, this is where COBRA doesn't count. A lot of people will say, I'm leaving my job, but I'm just going to take COBRA for 18 months and then I'll worry about Medicare. That won't fly. Medicare says you need to enroll in Part B to avoid penalty within 8 months of losing the employer insurance based on the current employment. COBRA is post-employment insurance. That's not going to count as a valid placeholder. So if you are losing your work insurance, you've got an 8-month window to join Medicare if you're over the age of 65. Now, what if you screw the whole thing up? What if you didn't take Medicare at 65? You didn't have the right kind of work insurance over 65, and now you still need to take Medicare, but you didn't do it right. Now you have a penalty, or you're going to deal with a penalty because you didn't have work insurance in the interim. There's still one shot left for you. Medicare does have something called the General Enrollment Period, or the GEP, and that's between January 1st and March 31st of any given year, where you can enroll for the following month to start Medicare. But if you enroll during this GEP, most likely it's because you didn't do it when you turned 65, and you didn't have a special election for having had work insurance along the way, so you're just left to this general enrollment period where you can join, but you'll most likely face a penalty for having not had Medicare and not having had credible work insurance. So keep an eye out and be careful. If you're turning 65, make sure you reach out to us or to anybody to get an education so that you do it properly. Now, one last piece, which is a tougher piece of information for some people to understand, but so important. A lot of people say, well, I've got work insurance. I don't want to take Medicare at 65, and they don't even consider taking a look at the difference in numbers. Well, not only is it important to compare costs and see which one is better, but some employer plans, namely those with less than 20 employees that work for the company, might actually either force you onto Medicare or stop paying your claims if you don't take Medicare. There's this huge deal, which is if your employer has more or less than 20 employees, this is going to affect what options you have. To keep it easy, if your employer has less than 20 employees, typically Medicare has to be the primary payer. You have to take Medicare, otherwise your employer insurance can choose not to pay your claims any longer. So if you work for a company with less than 20 employees, you better start planning on taking Medicare that you don't really have this choice. If you work for an employer that has more than 20 employees, then you're most likely to have the choice because Medicare can be what they call a secondary payer and your work insurance can still be primary. So again, when you're making this decision, sitting with an expert at the age of 65 is always the best thing to do so you don't make any mistakes and find yourself in a lifetime penalty. I haven't mentioned it yet, but that penalty they give you for screwing up your Medicare enrollment at 65 and joining late is permanent for the rest of your life. It's only a 10% penalty on the annual premium, which at this point might be $16 a month added to your Medicare Part B premium for every year you don't join, but it is permanent. As for a final piece, when you do join Medicare over the age of 65, don't fret. When you are new to Medicare Part B, even if it's not at the age of 65, you're still given all the enrollment windows that somebody at 65 is given for joining Medicare plans. Whether it's drug plans, Advantage plans, or joining a Medicare supplement with no health questions, you're given this same option when you join Medicare over 65, because being new to Medicare or having these new enrollment periods is usually worded as either turning 65 gets you the enrollment, or being new to Medicare Part B gets you the enrollment. So although you may be joining Medicare over the age of 65, because your Part B will be new, you'll still be given all of the enrollment windows you need to choose any plan you'd like with no hesitation, no health questions, and no restrictions. Now, if for any reason you fall in a scenario where you took Medicare at 65, but you continued to work anyway, and now you're retiring, you are still given a guaranteed issue window into drug plans, Advantage plans, and even a guaranteed issue into a supplement with no health question, but the plan choices are limited rather than having the full spectrum of choices for you. So to summarize, by joining Medicare over the age of 65, you can absolutely do that and you won't face a penalty if you have credible employer insurance from yourself or your spouse all the way through. If you don't have credible employer insurance, there will be a penalty and you'll have to join during the general election period. And feel free to wait if your insurance coverage is good or better than what Medicare has to offer, but do not pass up getting an education at 65 so you make sure you're doing it correctly and planning properly for the future before it's too late. If you need any help, feel free to reach out to us at njlifeandhealth.com. Call our office in Toms River at 848-226-6897, or comment below if you have questions. If there's anything you want us to do a video on in the future, feel free to like and subscribe for further videos, and we'll see you in the next one.